This is Midday Mobile with Sean Sullivan on FM Talk 106.5.
Welcome back. Midday Mobile on FM Talk 106.5. And time for a checkup. Rebecca Blaylock with AltaPointe, the school-based therapist for AltaPointe, joins me. Good to see you. Thanks for being here.
Thank you so much. I'm so excited to be here.
So tell me, what do you do? You're the school-based therapist for AltaPointe. So what does a day look like for you? What do you do?
Oh, goodness. Busy day for sure.
Right.
So pretty much just going in that school environment. I have an office at the school.
Okay.
And I have a schedule. I have, a certain caseload of kids that I serve there at the school. And so I just kind of set up a schedule and, have therapy sessions throughout the day. But have the space and flexibility for if a crisis comes up to be able to assist with that, or just kind of, plot out my day for, therapy sessions, but also consulting with teachers and parents that show up, just different things like that, just to kind of be an extra assistance.
So you're a resource on site for that school.
Yes, on site. It's a really good program because we're able to be there.
That's got to be a real benefit there. I mean, to have this, and how does that versus an office setting versus being in a school? Give me an idea, like how you benefit these children maybe, probably maybe more because they're closer to you?
Well, there's benefits obviously to an office, and the school-based setting, but it's just really awesome that we are able to be in the school because, in our communities, in our world in general, there's so many barriers with these families.
Right.
And such as transportation. I know that's a very big barrier in our community is transportation, And so we're able to be there on site and give the services, and a lot of times people think, oh, well, it's in the school, so it's probably, not a clinical, service. But no, it's still a medical clinical service we're providing. We're just able to be there, So, a lot of families, it is. A lot of families wouldn't be able to get these services if, we weren't on site to provide that because of transportation and different needs.
Well, let's talk about how does a school-based therapy differ from traditional therapy, like what we picture? Is it the same protocol or different? Or?
So the same protocol, but I like to think of it as, it can sometimes be scary for a child to go into an office setting. Anytime they think, hey, I'm going to the doctor or I have an appointment, they might immediately get anxious or think, hey, I don't want to go to this. But, being in the school setting, they're comfortable there. That's their place.
Right.
They spend, majority of their time there. And so in the school, they get to see you more. They, a lot of times they see you as some of the school staff, but they get to see you. I feel like it, helps build rapport more. They get comfortable with you. And, versus in an office, you're going to see them, when they just come in for an appointment. You may not see everything that's really going on. You can see them if they're, in the hall interacting great with, kids or, if they're in the office, having some trouble, but you just kind of get to see more of a whole picture. And I really feel like they get more comfortable. And like I said, building that rapport sooner. And they just think, oh, I have a person, here for me at the school. And so I know I can go to her when I need something.
To think about this is also might have an effect where other kids that might be unsure about it now see you, they know you by name. They know a friend had gone there. So, I use a word here, makes it okay.
Yeah, no, it does. I think definitely it makes it looked upon even, more accepting and just people want to reach out for the service more too, because like you said, they know me and it's really funny because, we're still under HIPAA, we're still under, confidentiality, but it's really funny because being in the schools, especially the younger ones, they're like, hey, there's my therapist, and I'm like, okay, but they're like, there's my therapist. Don't you want to go see her? And so I feel like it definitely encourages them and makes them feel more comfortable. Us just being in the school and feeling like they can really open up. And like I said, definitely knowing that we are a person there for them that's going to support them through whatever and just really be there for them.
What about the academic side? How does this school-based therapy improve academics?
So it can definitely, we can definitely help in that area. A big part of it is just being able to work with the teachers and the school staff, and the parent and that student, and really find out what they're struggling with in school. A lot of the times it's attendance and just kind of trying to get more involved in that, encouraging the parent, hey, we really need to just get them there and stuff. But we can also find out from the teacher, specifically what are some of those problematic areas that we need to focus on and kind of tie it into our treatment goals too and work on that. And then, sometimes it's a group effort. If the kid's like really struggling, we can kind of brainstorm with the school staff, administration, and say, hey, like what has worked, what has not, and like how can we come together and like make it the best possible situation for this kid to succeed.
Obviously, that's a benefit of the geography of being there at that school.
Yes, for sure.
What are the most common things that your patients are dealing with, children are facing today, mental health wise?
Okay, so there's so many different things, challenges, in our world today as far as kids and stuff, but there's a variety of like behavioral and emotional issues. Some of the main things, mental health wise, that we see are children having anxiety, ADHD, disruptive behaviors, depression, anger, oppositional behaviors, divorce, a lot of family transitions,
right.
A lot of having to move, that kind of creates some stuff for them, as well as some social skill deficits too. Being adults, we face challenges every day and we struggle.
Right.
But, we're a good bit older.
Yes.
So we kind of learned how to like self-regulate, how to kind of be aware of like, hey, I have this going on. Like I need to work on this.
Right.
But these babies, and I mean, they're not all babies. We see teenagers too, but, they don't necessarily have that world view yet and that self-awareness to realize, hey, I have this going on, and be able to kind of like work through those things. So that's why I think it's very important to like be involved and get these kids, teaching them these skills at a young age so they can learn and cope with any challenges they may face. And it just helps families and the children, be able to work with a therapist. And like I said, set those goals so they can start working on these things, together and start hopefully like relieving some of these symptoms of the things like anxiety and all the different things I named. Because that's our ultimate goal. We just want them to be able to function better and like be happier and not have so many symptoms for sure.
So let's think about this maybe from the school setting, Rebecca, that, you have schoolwork and then you have homework. Yes. Right. And you go home and it's parents will all say, we're like, yeah, I'm responsible, to make sure they get their homework done. So we're part of their academic.
Yeah.
But what about on your side? Like if you're seeing a child and I don't know if you give them things to work on or whatever, do you bring the parents in or the family? How does that work?
As far as like in the treatment and sessions?
Yeah.
No, actually we really encourage parent involvement because I come from a systems background. So I think at the end of the day, their family unit and their environment they're in play such a huge role in how they, function every day and how they can handle things. And we really try to get the parents involved. They can actually come to the school for sessions.
Okay.
We can sit in and help like in IEP meetings for like any, individual plans that need to be done, just kind of providing that assistance. But like I said, just getting them involved and realizing, hey, it's all of us together because, that kid has issues in school, but they also have like things that go on at home and other social settings. So we don't want to just address like what's going on in the school. We definitely want to, pinpoint that for sure. But it's, we want to work with that family and we just really want them to come in because when those kids realize, hey, my parent is taking the time out to really be involved and they see, because, kids pay attention a lot more than we think. When they see that
especially if you whisper. That's
oh my
when
gosh,
they really pay attention.
The things that they shouldn't be hearing that we say, we're like, oh gosh, they heard me.
Yes.
But, when they see someone in their life that's important to them, really making the effort to like participate and really start working with them. Because, these parents, they got to be these children's advocate, and they need to fight for their kids. And so when those kids see that, I feel like it makes it an even more positive experience. And so we definitely encourage the parents to be involved and come to the school for sessions or be, involved as much as possible.
Well, this is great too, because somebody's listening to you, Rebecca, right now. They want to reach out to find out this is available for their school or something. How do they do that?
So they can, the main way to reach out is they can call our Access to Care line. And that's kind of our home base, just calling in saying, hey, I want some services. And so that's at 251-450-2211. And they'll just say, hey, I'm really thinking my kid needs some services. I want to see if this is available. And so then they'll set them up for an intake process and they will go through an intake. And then if someone's at their school when they're in that intake and they say, hey, I go to this school, they'll say, hey, we have somebody there and give them that option.
That's how they match y'all.
Yes,
okay.
But they also can reach out to the school because the schools are really good about giving us referrals to, if they see that a kid's really struggling and not really being able to make some strides in those areas, they'll usually refer us or get a parent linked up to us so we could actually open them at the school for that intake as well.
Well, thank you for this eye-opener for so many families out there.
Yes, no, thank you so much.
Rebecca Blaylock, school-based therapist for AltaPointe AltaPointe Health right here on Midday Mobile's Time for a Checkup.